to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Manoj Sharma. Thank you so much for being here this morning, Doctor.
It's my pleasure. Thank you for inviting me.
Oh, we are delighted to have you. Today we are talking about structural heart disease. So what is that, Doctor?
So structural heart disease is when there is a problem with the heart structures in the heart, such as the valves or abnormal communication in the heart. And it may be due to acquired or congenital diseases. In simple terms, whenever any structural component of the heart is involved. Typically, these defects were repaired surgically. Over the years, more and more procedures are being repaired and treated in the cardiac catheterization lab. And these treatments involve closing the holes in the heart with catheter-based plugs or other devices. Over the last 10-15 years, we've been replacing and repairing heart valves. So the approach has changed, and now there is a structural heart program with involvement of surgeon and invasive and interventional cardiologist. Hence, the term structural heart disease, which is a specialized term which can be repaired or treated by various physicians in the hospital.
Okay, great. Thank you for explaining that. Now tell us, there's a procedure. It's called the TAVR procedure. So what is that, and who is that for, Doctor?
So TAVR is a short form from transcatheter aortic valve replacement. The aortic valve is a valve through which the blood is coming out of the heart and is pumped out to the rest of the body. This valve acts like a check valve. Now, it is subjected to disease, and it can become narrowed with thickening and calcification. And typically, this means that it requires replacement, and this used to be done by surgery. The surgery is a bigger procedure which involves 6 to 8 or 6 to 10 weeks of recovery. And not all patients may be candidates for surgery due to a variety of reasons, such as advanced age, high-risk procedures, other comorbid conditions. So TAVR was initially developed for such patients who were not candidates for surgery. Over the years, the technique has developed, matured, and been perfected. It has now become almost an alternative to surgery in all the patients who have aortic valve narrowing, irrespective of the risk of surgery. Briefly, how TAVR is done. There is a tube that is inserted into the groin and through which a catheter is placed, which has a balloon on which a valve is mounted. The valve is like sewed onto a stent, and after crossing the heart valve, this valve is deployed so that the old valve is pushed to the side and the new valve functions like a brand new valve. The patient recovers within 6 hours or so and is able to sit up, and then may even go home in 24 hours or 48 hours. The patient can go back to normal activities almost in 5 to 7 days.
Oh, wow. And Covenant, Doctor, has a structural heart program. Why is this such an asset to the community, Doctor?
So Covenant was the pioneer hospital offering TAVR in the Tri-City area, starting in September 2014. Since then, we have maintained outcomes which are comparable to national standards. We have done largest number of cases in this area. It provides an opportunity of local treatment to the community without having to travel. We have an expert surgeon who provides excellent backup and knowledge and know-how in determining the right approach for these patients. We have a multidisciplinary team, so the patients get a holistic approach. Covenant offers structural heart clinic, or a center where patients can get everything taken care of under one roof. It includes a cardiologist, a surgeon, echocardiographer, and then there is our ancillary staff such as schedulers, nursing, TAVR coordinator, CAT scan. All these things are provided under one roof, so the patient does not have to go from one place to the other and gets all the care in under one roof.
Yeah.
Not only in the Tri-City areas, we get referrals from surrounding counties, northern Michigan and Thumb area. We have our partners who work in the outreach areas to provide easy access to these patients in rural areas, and our staff works with them to provide much needed specialized care.
Well, that's very convenient for patients. So, well, let's talk about this. We are right in the middle of this devastating pandemic. So how has the pandemic impacted people seeking treatment for heart disease, Doctor?
Yeah, that is a sad situation. You know, pandemic had unfortunate repercussions on all our patients in numerous ways.
Yes.
And our TAVR patients also were impacted, unfortunately. In 2020, in March and April, when elective procedures were limited, some of the procedures were delayed. Furthermore, due to scare of pandemic, these patients who are already old and have had more predisposition to side bad effects of COVID, they tended to stay at home and delayed testing even when they were recommended due to seriousness of their condition. We saw a greater number of patients reluctant to come in. Unfortunately, we had more patients who presented then as sicker patients and had bad outcomes. This has been seen all over the country and all over the world. But we have learned lessons. These patients who are sicker, they should not wait that long. We have modified our strategy. We do not delay this testing. They have a shorter stay in the hospital. We avoid ICU as much as possible. And we test them frequently whenever they come for other tests for the TAVR program.
Yes.
We encourage our patients to call us. We frequently check on them while they're waiting. Hopefully, we can get our hands around this pandemic and move along to provide much needed care to all our patients without any barriers.
It seems like you're taking all the precautions and protocols necessary to keep your patients safe. We love to hear that. So, doctor, we can tell that you're very passionate about what you do. So why did you become a cardiologist, and why is this so rewarding for you, doctor?
Well, since medical school training, I was a procedure-oriented guy. I was always impressed by cutting-edge technology in medicine and how it can be used to help patients in different ways. Cardiology is a great example of that and has given me excellent opportunity for that. As I've progressed in my career, I realized that what gives me most satisfaction at the end of the day is when I see a patient feeling better, or when I see a spouse, a child, a sibling relieved that their loved one is going to be better. It makes all worth it. It is the moment that I feel I'm blessed, and with great humility, I can tell myself that I made a difference in someone's life for better. That's my greatest reward.
Patients will be very lucky to have you as their cardiologist. Thank you for joining us today, Dr. Sharma.
Thank you.
You are welcome. And if you'd like any more information on today's topic, just head on over to the Hot Links page. That's on WNEM.com.